Now for the next up, we are going to talk about the ovarian tumors. Ovarian tumors, alright, and these are the investigations. So I'm suspecting that a patient has ovarian tumor, probably from my history taken and my physical examination. Alright, so what next am I to do? To confirm, of course, I have not opened their pelvis to be able to know whether the ovarian tumor is there or not. Okay, so there are things that I could do from outside that will give me an idea. Now you might actually want to start thinking. So of course, to me, things like, do imagings, blood test to check out for any biomarkers, So let's look at them. We said that to diagnose or investigate these ovarian tumors, you are trying to combine a lot of clinical evaluations. Okay, clinical evaluations, images, laboratory tests, sometimes surgical procedures even. Okay, so initially you do history taking, symptoms analysis, physical examination. I've spoken about that one. Then imaging studies are the first line. Okay, so transvaginal ultrasound, you want to access the size, access the structure, access the amount of blood vessels that are supplying the ovarian mass. Of course, this will give you an idea to how fast it will be developing. Abdominal CT scans, pelvic CT scans, MRIs, PET scans, CT scans. Okay, all of these are images just to see the inside of the pelvis. Then laboratory tests, I'm doing all those, carbohydrate antigen 125 blood tests because it's a biomarker for ovarian tumors. Risk of malignancy index. Okay, other tumor markers. Okay, I just try to check out for other tumor markers. All right, just to further confirm that there's a risk, for tumor coming up. Histological confirmation, that's surgical evaluation, biopsies. That's when I will now take, that's why I will now take that's when I will now take some tissues, send it to the lab. Genetic testing, this is where I'll now do a test to see if there's any other genes that have issues. Okay, so that's it.